Grown Folks Table returning for a new season. Thursday, October 6th at 8 p.m. on Facebook Live. It's real women addressing real issues from relationships to politics to health and wellness. And yes, we pour a little tea and so much more. So pull up a seat and join Vicky, Libby, Dolores, Joyce, and Alicia at the Grown Folks Table.
Hello and welcome to the Grown Folks Table. Are you guys ready to have some Grown Folks Table conversation today?
We are definitely ready for that.
I am so glad to be here with my sisters. It has been some time since we've been together and we're all back together. How y'all feeling? Good. I'm feeling, we just fell up in the fall, huh? I mean, we
Fell
just
up in it.
woke up and it was just fall. Just like that.
Just like that.
I mean, at one minute it was hot July, now we just falling in the fall like it's nothing.
But this is my time of year. I
is.
love fall and I love winter.
Why is that? Is it because your birthday kind of falls towards the end?
Yes, ma'am.
See?
That's why December is a good month for me. But I just like the cooler weather. Yeah. Being a seasoned woman, we already walk around summer all the time.
Yes.
So when it becomes a little cooler, that helps us out. So I just love the change of the season. I love the temperature. I love the whole look of the season.
Yes, me too. I can smell Thanksgiving and Christmas. Mm-hmm. Are y'all ready for all of that?
I also smell them pounds. We're trying to lose some of that weight from summer.
You know what? Well, that's what we get right here at the Grown Folks Table. We look forward to season. Some people want to lose weight. Some people are ready to have a good time. But it's a new season. And here today, we're talking about something that's very endeared to us, especially for Black women. It's Black women and breast cancer. Mm-hmm. And wanting to know more information about it, even though we continue to have conversations. And I think that a lot of times we have become, more knowledgeable. But there's still some things that are unfolding that people don't pay attention to. So we have a very special guest here today, Dr. Rylan Gore, who is a breast surgical oncologist, and she is going to bring some very great knowledge to the table. Please welcome and tell everybody about yourself.
Thank you for having me. I'm Dr. Rylan Gore. I'm a Georgia girl, born and raised, so it's nice being back here in Atlanta to help take care of the women and the community that helped raise me. I practice here, I live here, and I'm just happy to be here and to give more information and answer whatever it is you need to know.
Well, it feels so good to have an expert at the table because it's a very serious and dear topic to all the women here at the table. I know that annually Dolores hosts a Black and Pink Ball with 100 Black women because she cares so much for for breast cancer. And so we want to just talk more about it and make sure that we inform the community of women. And can you just start off by telling us what exactly is breast cancer?
Absolutely. So breast cancer is when the cells of the breast, whether it starts in the milk ducts, these are the tubes that transport milk to the nipple, whether it starts there or in the milk lobules. These are the milk producing glands of the breast. So this is usually where breast cancer starts. The most common breast cancer is invasive ductal carcinoma, meaning the cancer started in the milk ducts. And this accounts for 70% of breast cancers. It's the most common one. This is super common and something that is so dear to my heart. I think we all know somebody. If we haven't been personally affected, we know somebody who has. 1 in 8 women, period. 1 in 8 women. It doesn't matter whether you have a family history or not. 75% of women who get a breast cancer diagnosis do not have a family history at all. And so I find that so many women are flabbergasted. They're like, wait, this doesn't even run in my family. How did this happen to me? Welcome to the club. 13% of women are going to be affected across the board. This number continues to go up in Georgia. I want to say 8,000 cases of breast cancer were diagnosed in Georgia alone. In the last year, 250,000 women will have invasive breast cancer. Over 50,000 are going to have the non-invasive breast cancer. And then men aren't exempt. Our Black men aren't exempt. Men account for 1% of cases. We are diagnosed at the same rates as our white counterparts, but we're 40% more likely to die. And so that's where the health disparities and health equity and trying to figure out where can we bridge the gap, that's where that comes in. 50,000 women are going to die each year.
Well, I'm glad that you brought up the fact that 1 in every 8 women, whether it's family, it runs in your family or not, because a lot of times we're walking in that reality, saying, well, no one in my family has it, so I have a better chance of not getting it. And so is that what you're saying today, that's not,
it doesn't make
that's
a
not
difference.
Right.
It doesn't make a difference at all. If you have a family history, of course, you need to just be more cognizant. I find that in our families, in Black families, we don't know what happened to grandma. We don't know what happened to granddad, and we're not having these conversations. I think it's starting to get better, and we are starting to have the conversation more like, hold up, how did grandma die? Or even my own family. Trying to figure out, somebody had a diagnosis and we're asking questions and we're like, what? How come nobody ever mentioned this before? Certainly when you have a family history, your risk goes up. And so these are things that I need to know, or your primary care physician, whoever you're going to, they need to know that.
Dr. Gore, I was thinking about the disparity with women of color. If I understood you, which is real startling that we as Black women tend to die more than our counterparts. Would you share what can the reasons for that? And we know that there are economics play a part in that, the lack of insurance. Could you talk about what can we as a community do to improve those numbers where we are not dying at alarming rates? Or is there anything we can do? I just wonder about that.
It's so multifactorial, and so when I'm speaking to patients, I'm a big proponent of patients being advocates for themselves and asking the questions, or even if I have to give a talk somewhere, I'll end the presentation with a slide. So you got diagnosed with breast cancer. Ask your doctor, ask them these questions right here. Like, you're going to go in and you're going to get the information. I think there's so many reasons why we're more affected. Number one, we're more likely to have more advanced disease at the time we're diagnosed. And so a white woman walks in, she's stage 1 or maybe even stage 0 because she has non-invasive breast cancer. We're more likely to have stage 3, stage 4 disease at the time of diagnosis. And that's for so many different reasons. We're more likely to have the most aggressive form of breast cancer, which is triple negative breast cancer. Anytime somebody has a breast cancer diagnosis, in addition to, the pathologist looking at that tissue under the microscope, when you have a biopsy, they're looking at 3 different things on that tumor. Does it express the female hormones, estrogen and progesterone? And does it express another receptor called the HER2 receptor? Having this information is important because it helps determine additional treatments that we can do to prevent this from happening again. Well, our tumors are more likely to be triple negative, meaning it's negative for those 3 things. And so when that's the case, the tumor is more aggressive, there's less targets, less medications that can be used to treat it. And then those tumors are also more likely to be more advanced, larger in size, more likely to be in the lymph nodes, more likely to travel outside of the breast and the lymph nodes at the time of diagnosis. And so just tumor biology in itself makes it that we have worse outcomes. But then you add on top of the fact that studies have shown from screening all the way to survivorship, Black women fare poorly. And it's for so many reasons: socioeconomic status. COVID did a number, on an already difficult situation. So people losing their jobs, people losing insurance. You can't get your screening because you have to work, or you're working from home and you can't get childcare. During COVID, places shut down. And so we weren't even doing screenings at the hospital for a long time. Those got delayed. So if you see patients with mammograms delayed by 1 to 2 years, I had a young girl during COVID, at the height of COVID. So I want to say April, May. She went to the hospital 3 times with a complaint of a lump in her breast. She's young. She was in her early 20s. Got ignored every single time. Oh, it's an infection. Here's some antibiotics. They gave her antibiotics 3 times. Did no kind of imaging. They were like, oh, this is an infection. How? She's not breastfeeding. She hasn't had any kind of bug bites or anything to suggest an infection. She doesn't have any abnormalities in her labs. Why would you assume that this is an infection? She has a raging tumor, that I diagnosed. And so not being taken seriously by the medical establishment itself. We also know that Black women, we're less likely to be offered the correct surgical procedures. We are more likely to have delays in diagnosis. So you get your mammogram right and it's abnormal. We're more likely to have delays up to 3 months in getting follow-up imaging or a biopsy. That leads to later disease and worse outcomes. We're less likely to get radiation or get radiation at accredited institution. Even if, say, you want your surgery right and you decide, I'm not dealing with this again. I'm going to get mastectomy. I'm going to get reconstruction. This sucks, but I'm about to get the body I always wanted. This is about to rock. We're less likely to be offered breast reconstruction. We're less likely to be offered new surgical procedures and reconstruction procedures. We're less likely to get appropriate chemotherapy regimens. So you see where this is going, right? You see where this is going. This is why we don't do well.
So as a medical professional, as a Black woman in this field, then what would you say that we need to do to help those situations that you just mentioned?
I empower my patients so much. They're like, I went to this doctor and I told them Dr. Gore said, they'll have a list. What should I say? Say this. And if you have a problem, tell them to call me because I'm going to follow up on it. But what happens when you don't have a patient who feels comfortable advocating for themselves? And it's something that you have to learn over time. I've always been a loudmouth, right? So it's like, I don't mind. But a lot of people don't have that. They're scared, It's like somebody just told you have cancer, and a lot of times you maybe know something about the medical field, but explaining it to your family and getting other people on board to help and having that support system just to get through it. It's a long journey. I mean, for most patients, you're going to be going through something for the better part of a year. And so if you also don't have the support system, it can be extremely difficult. And I've had patients who've dropped out of chemo or just stopped doing certain things because it was too much. And so I'm a big advocate for my patients, and I'll give them the playbook. I'll tell them, so say this when you go, or I think at the end of the day, going to physicians who believe in you and love what they're doing, and they're going to advocate for you, whether they are black or white or green. I really don't care as long as it's the right physician. I got to say, most of the plastic surgeons I work with, most of them are white. Most of them are white men, actually. A couple of white women. There are a couple who are Black female plastic surgeons. But I got to say, the white, whether it's the white male plastic surgeon or the Black female, these people go so hard for my patients, and they're like, what do you mean so-and-so told you couldn't get reconstruction? You can get reconstruction. Let's just do it this way. I've never met kinder people. So I think having a team who thinks like you and who is willing to do the right thing for the patient regardless of their situation and regardless of what they look like is very difficult. And I think training up more Black doctors will help nip some of this in the bud.
I did have a question because I wanted to know what was the age now that they are starting to get their breast exams. I know it was 50, but surely it's a lot younger now because I know a lot of young women in their 20s, and I know one in her 30s now. And she went through everything you were talking about.
Mm-hmm.
And she went to the internal medicine doctor. That's where it started.
Mm-hmm.
But the other part of it is, why does it take them so long to identify with what is going on? And the same thing she talked about was that he kept saying it was an infection. It was other things, but it was not, the lump was not something that was serious, not to send her out or refer her out to a specialist. And this young lady now has lost her breast. She's 33 years old. And I was just wondering now, is it a certain age, or is it not insurance companies are paying for it, for them to start going at younger ages, like in their late 20s? Because I know a lot of young ladies in their 20s who we lost to breast cancer. Mm-hmm. Mm-hmm. So I just wanted to know, is it the age? What's the age now?
So the age has never been 50. So there are certain organizations that recommend starting at age 50 to age 74. That's United States Preventive Services Task Force. That's a big no-no. American Cancer Society recommends starting at 45 to 54 every year, from 55 to 74, 75 every other year. Mm-hmm. Full stop. Absolutely not. Black women are more likely to be diagnosed before the age of 40. This is documented. I can email out the studies. And so, full stop. And I have a big problem with it. And I ring the alarm every single time, because if Black women are more likely to be diagnosed before the age of 40, and you're telling people to start at 45 to 54, and then primary care doctors, these are the recommendations that they're following. Now you have at least a 10-year gap where you've missed the opportunity to intervene, and now there's another life lost, and that life is more likely to be Black. The organizations that we go by, National Comprehensive Cancer Network, ACOG, the OB-GYN group, those organizations, they recommend starting at 40 years of age, period. Mm-hmm. Period. Now, over the last 3 to 4 years, guidelines have also come out recommending that Black women actually start their screening mammograms at the age of 35, because of the fact that we're more likely to be diagnosed before the age of 40.
Wow. So, but how do you do that? Because a lot of times, I just remember before I turned age of getting a mammogram, and I would go in the doctor's office and say, oh, is it time for me to get a mammogram? Then when I turned 40, that number changed when the insurance would kick in and cover, or when your doctor said, okay, it's time for you to go get your mammogram. So how do you navigate that maintenance? Is that an insurance thing? Do you have to have a history before they would put you on to go and get your mammogram?
I've never had an issue with mammograms getting covered, screening mammograms starting at the age of 40. Mm-hmm. I find that a lot of times when my young women come in, there's a complaint anyway. They're like, I feel something, this doesn't feel right, this hurts, whatever. Full stop. First of all, if somebody comes in with a complaint, you need to work it up appropriately, and it's no longer a screening mammogram. That's a diagnostic mammogram. Okay. Meaning it gets read the same day by the radiologist. And if they find something abnormal, then further workup ensues at that time. And so if a patient is coming in with a complaint, anyway, my breast hurts, I feel a new lump that wasn't there before, and the doctor is ordering a screening mammogram, then we have a separate problem, because they don't know what they're doing. And so I tell patients, if there's a concern and you're not getting what you need, just give me a call, and I order it. And I've never had any issues when it comes to some of the younger patients who want to start at 35, 36 if insurance doesn't cover it. I can be annoying. I'm one of those people. I get on the phone with the insurance company. I'll start sending papers and what the new guidelines state and what this organization states, and I get it covered. But again, that's assuming that you're going to a physician that's willing to also advocate for you. And it's tough. I got to say, it's tough. These insurance companies they're goons. Mm-hmm. It's gotten really hard. It's gotten really hard over the last few years.
Well, another thing is, I feel convicted sitting here with you today. Because no. But let me tell you why, though. I'm gonna go ahead and just lay it all out on the table. I am riding around with an order from my doctor that told me to go get my mammogram. I had my.
How long has this been in your car?
I don't want to talk about it.
You brought it up.
I don't want to. How long has it been in her car?
But I am one of those people. See, that I'm not taking it serious enough. And it was when you start laying out those, demographics, I was like, okay, when I get in the car, I'm going to go ahead because I have the order. I just haven't pressed the button. And that's me putting me first,
Sometimes it's us not taking care of ourselves.
Yes.
Like I am absolutely horrible with self-care. Horrible. These men, they don't think twice about their little self-care. I'm like, if he goes on one more golf trip, like how many golf trips y'all got to go on in a 2-month, 3-month span? We don't do a good job of self-care, but we're also the ones who are like taking care of the family and making sure everyone is okay. And so if we're not healthy, they're not going to be healthy. And I find sometimes too, especially for my Black women, God forbid you've been feeling funny or something doesn't feel right. Right. It's the fear factor. And I don't discount that at all because it's real. It's real.
One thing, Dr. Gore, I really I appreciate what you're describing yourself as a doctor is relational.
Yes,
and
absolutely.
That's who I am. I thrive on that. And when I go to the doctor and if I feel transactional, and I've literally gone into a doctor's office where they are typing on the screen. And so they're not making eye contact at all. And so here the doctor is looking this way.
Right.
So how you feeling? And when was your last time? Now I'm over here.
Right.
And I'm like, I'm going to wait to see when you're going to look at me. I get disturbed. And that is happening more frequently than not. I said to a doctor a few years ago, a very pronounced clinic, and I said, have you ever heard of Marcus Welby, MD? and I know that dates me. And he said, no, can't say I have. I said, well, Marcus Welby, MD, I watched him on TV. And when you would go in the office, this is how it would play out. Hey, Vicki, how are you? How's Rob? How's the kids? Did you didn't graduate?
Right.
Family.
Yeah.
And I said, you know what he said to me? He said, Miss Turner, the days of that are gone. He said, we are on a schedule with how much time we are to spend with our patients. So to hear you say that, I hope I don't have to come to you, but I believe you could make some recommendations for us because the older I get, the more that's important to me.
Yes.
And I don't want to just be a number. I don't want to just be a paper or a diagnosis. I like relationships, and you don't have to spend all day.
I'm honestly appalled. Yeah. Like
that was a doctor of color.
Even if you're thinking that, who says that out loud? First of all, but and maybe it's just different for me. But I'm dealing with cancer patients. They are scared. I don't believe in taking. First of all, I don't take computers into rooms because it's like I'm really trying to get to know you, and now I have to break down a scary diagnosis and what you have to look forward to, and what do these words mean, and what does this stage mean. So I strongly encourage patients, even if I refer them to somebody and maybe the interaction didn't go so hot, if they want another recommendation, then I just give it to them, because the last thing I want is for a patient to feel uncomfortable. I make it a point to tell my patients, you walk through this door like you came to see me. Especially when they were going to Forsyth, y'all. Like, how many hospitals and offices did you have to pass to get here? Like, a lot. And so you're family now. And then just thinking about some of the things my family has been through. My mother is a twin. And my aunt, who is a nurse by training, the last few years of her life were kind of rough. But to have a cancer and a breast cancer and to feel like you have to go through it alone and to let it grow out of control. No treatment, no nothing. And it's like, I get it. We're family. Sometimes you don't want to deal with a family member taking care of you like that or whatever. But I could have at least pointed you in the right direction. And now it went to stage 4. The last couple of weeks of her life, she didn't even know who we were. And so instead of, treatments and taking the cancer out, I'm doing dressing changes on my aunt who doesn't even know who I am anymore, And so I tell patients, your family, I'm not going to do anything that I wouldn't want for myself. I get nervous every time I get a mammogram, and I'm nosy. I'll go back there like, all right, what are we looking at? Let me see. Let me see. Oh, what's that spot? Go talk to the radiologist right now. Like, I don't like that. Like, what is going on here? But I tell patients, your family. I'm not going to do anything that I wouldn't want for my mom or myself or my aunt or my sisters. I think about all the women in my life.
So what then? I know some things you just cannot control, but can you give our viewers some insight on what are some of the preventives that we can do, and how important those mammograms are?
Mammograms are so important. Even if it's difficult to start at 35, by the age of 40, you should be going every single year. I can't stress that enough. Every single year. Some people skip it. I know COVID and all these things happen. I'm not looking at you like that.
Look at her.
She's
Look
looking
at
at
her.
me. I don't want her.
It is hard.
It will be taken care of this week.
It is hard. I'm not trying to convict anybody, y'all. I'm just saying that every single year, get it done. Things that we can do. Unfortunately, breast cancer is one of those things. It's really hard to prevent. And so I think the things that we do for overall wellness, we should take more seriously. And I'm guilty too. And we just got to do it. And so physical activity has been shown to minimize the risk of a lot of cancers. And so if we're getting 20 to 30 minutes per day, 4 to 5 days a week, that'll help. I tell patients to eat your colors. And so minimize processed food, minimize fast food, fatty foods, fruits, vegetables.
Everything.
All the good stuff.
But Dr. Gore,
Bye.
Dr. Gore, my mother, she did not win her battle with breast cancer, nor my sister also. She was a breast cancer survivor, but she passed through of some other illnesses. However, now I am on a every 6 months diagnostics routine. My question is, and I know that the internal medicine doctor gets the work order and he gets the results and everything, but who should I be seeing after this? Just, he's not doing breast exams or anything when I go in his office.
How? It's like most patients don't even feel comfortable. I tell patients they're yours. Like, touch them. You should know what it feels like. You should know what normal and abnormal for you feels like. But I don't understand how we go into the doctor's office and we're not even getting full exams. When I have patients say, I went for my annual, what did they find? Did they do a skin exam? Did they do this? Nothing. What do you mean they didn't do anything? Like, that's not an annual exam then. And so if it's not your internal medicine doc or your OB, one of them needs to be doing a breast exam every time you show up in there. And I do have some patients, especially those who have to go every 6 months for whatever reason. A lot of my patients, they're like, let's just cut out the middleman, and they come see me after their mammogram every 6 months or whatever, because they're like, I'm tired of going back and forth with somebody who might not be comfortable or not quite sure. I can't believe you said that. I'm just flabbergasted, honestly.
I am too, because it's been years. Because my mother, I think it was about 10 years ago, my mother passed of it. But yeah, I've been going on this cycle thing for years, back and forth. Because first I was doing the mammogram, and then it became I had to start doing this diagnosis thing. So if it's not the left, now it's your right. Then it's your left, and then they start bringing all these different people in. I said, oh my God, okay, so let me prepare myself for the news. That was the last time I went. And so, but then it became, we're just going to continue to watch it. Everything's all right for right now. But I do know that I am in a high risk, and
then it's
I try to eat right, but that's not all the time. But I think because my mother had breast cancer, and I think my sister too, so I guess my chance, and being menopausal, I guess that puts me in high risk.
And I really think your family history alone puts you at high risk as far as I'm concerned. And so, especially with all these diagnostics, I really think that you should probably consider genetic testing. Okay. And you meet the criteria for it because you have 2 first-degree relatives who've had a breast cancer diagnosis. And that's another thing that really just kind of, like my mom says, that gripes my butt. She'd be like, that gripes my butt.
Well, I'm glad you said
because
that.
we're not offering our Black patients genetic testing,
yes,
even when they need it.
Yes.
Never.
Yes.
And so, your family history might not have anything to do with it, but certainly with the breast cancer diagnosis, and certainly a patient in your position, I don't understand why you weren't on one of the first things smoking to a genetic counselor.
So for anyone that's watching today, if they have received the diagnosis, what's next?
If you have received a diagnosis, you should see an oncologist, whether that's a breast surgical oncologist like me or a medical oncologist. One of these people should be offering you genetic testing, because this definitely will impact decisions that are made regarding treatments and regarding surgery. That's where you start.
That's where we start.
That's where you start.
Well, it has been such a pleasure having you here, Dr. Gore. I mean,
you for having me.
I like I said, I've already been convicted. I'm going Monday to call and make sure I schedule my appointment. And so for everyone else, go and get your mammograms.
Go get 'em.
Preventive care is the way.
They save lives.
It
Yeah.
saves lives. Thank you so much for joining us today. Can
Yes.
you tell our viewers how, if they want to connect with you, how they could connect with you if possible?
Yes. So I am on all social media. Twitter is not really my thing, but I'm there. Twitter, Facebook, Instagram. My handle is at Ryland Gore MD. And so it'll be really easy to find me. And I promise my pages aren't locked down. So you'll be able to add me and message me. And then further information will be coming in the future about my private practice. So stay
We'll just
tuned.
have to bring you back.
We will.
We'll bring you back so you can talk about your private practice,
Yes.
and we can flood people to your office, including me. But anyway, but one thing that I do all of my physical self-care around my birthday. So every December, I'm in this office, this office, this office.
Most people do. It's so
Yes.
easy to remember.
that
when you do
that
it
has
way.
worked for me.
Yeah.
Is doing them around. That's my gift
Yes.
to me, is
Yes.
to check all those things off.
Yes, absolutely. Well, thank you guys so much for being a part of the conversation.
Thank you.
With Black women and breast cancer. And thank you for being a guest at the Grown Folks Table. And we'll be right back here next week. Enjoy.
Thank you.
Thank you.
you.
Thank you.